Hi, everybody. Welcome to another exciting edition of Living at Your Highest Quality of Life with the doctors at Inspire Wellness. I'm Dr. Dan Neides here to guide you on today's topic of heavy metals and why they're so important from a detoxification standpoint. So, thank you very much for joining us. It is absolutely my pleasure to be doing these Facebook Lives. Today, I'm flying solo as Dr. Hutchins is working at the Kemper House, which is a nursing home facility focusing on Alzheimer's patients. So we're working diligently with them, trying to help them improve their quality of life. So shameless self-promotion, if you are dealing with early onset dementia, if you have a loved one with Alzheimer's disease of any type, we are following the Bredesen protocol. If you're not familiar with that, The End of Alzheimer's Disease is a book written by Dr. Dale Bredesen, and we are believers in all things lifestyle to try to improve and reverse the complications associated with Alzheimer's disease. So we're working very closely with them. So I wanted to give a shout out to the Kemper House and thank them for their work with us. And thanks to Dr. Hutchins for doing that today. So today we're going to be talking about the importance of heavy metal toxicity on chronic disease. So remember, when we are discussing chronic diseases, we keep coming back to the role of inflammation, deficiencies of vitamins and minerals, and then challenges detoxifying. And when we talk about detoxification, we are looking for those disruptors, which can be things like organisms, so maybe yeast or candida, could be bacteria, parasite, viruses can be disruptors that need to be detoxified out. Food can certainly be problematic for people who have food sensitivities. And then heavy metal seems to be a big category that act as disruptors to normal body chemistry. So we wanted to spend a little bit of time today giving you some important information about heavy metals and again, why it's so important that we get these out of our bodies. So if you have been dealing with a heavy metal toxicity issue, you're battling symptoms, perhaps maybe you've been treated, know a loved one that's been treated, even as potentially aggressively as needing chelation because the levels of metals were so high, we certainly understand that it can be frustrating and it can be quite a long time before you're actually feeling your optimal self. So again, we're here to support you on that journey if we can be of assistance. But what are some of the symptoms that people complain of if they're dealing with heavy metal issues? It could be fatigue, number one of the list. It could be digestive related issues. It could be issues with infertility, menstrual irregularities, problems with memory, especially because we recognize that metals don't tend to be found in our bloodstream. They settle in brain, bone, and fat. So let me remind you of that. When we get exposed to heavy metals like lead, mercury, arsenic, aluminum, as examples, cadmium, thallium, these are metals that come from the environment and then can potentially get into our bodies and act as disruptors. So recognizing that they can settle in brain, bone, and fat, this can be particularly problematic for our nervous system. And so memory loss can be a problem attributed to heavy metal toxicity. And then one thing I do want to mention that we see not that infrequently is brain fog, especially in women who are entering the menopause. And so one of the interesting phenomena associated with it, so remember I told you that metals tend to settle in brain, bone, and fat. So if you have the heavy metals that are settling in bone, and then as you're transitioning through the menopause and starting to lose bone mass, maybe not necessarily osteoporosis, but you could develop low bone density, which is called osteopenia. So as we start to lose bone mass, especially as I think more frequently it's happening in women as they have a decrease in estrogen as they make that transition, the bone density begins to decline. And if you have metals that are there basically hanging on or attached to the bony matrix, well, as that matrix goes away, those metals can be released and then they're going to swim around the bloodstream and eventually settle either in fat or potentially in your brain. So there's a connection potentially between osteopenia, osteoporosis, and brain fog related to heavy metal toxicity. So these are some of the symptoms. And again, we recognize that people are suffering with these symptoms. And again, any way that we can be here to support you, we certainly want to do that for you. Let me remind you about the importance of optimal nutrition as it relates to heavy metals, especially if we're trying to get them out of our body. So remember, we want normal body chemistry, and we want our bodies functioning at the highest level. But what we do recognize is that if we don't have enough calcium and we're exposed to lead, lead could potentially replace calcium in the body, leading to chemical disruptions. So the same thing as it relates to a decrease in the overall amount of zinc in your body, that can be replaced by cadmium. Manganese can be replaced by nickel, and then magnesium can be replaced by aluminum. So now we want to think about where are some of our exposures coming from as it relates to heavy metals. And so when we're counseling people on reducing their exposure to toxins, we'll oftentimes have a discussion about potential metal exposures in the individual. And we also have pretty decent handouts on where we can avoid toxic exposures, thinking about where they may be in our own environment, whether it be at home or at work, or even just walking throughout the city that we live in. But if you're looking to identify where exposures may be coming from and what can we do to reduce our exposures, one of the important things that we can do is start looking at what we're using in our own homes. So from a cookware standpoint, we would say it is important to avoid any type of aluminum cookware and replace that with either glass, ceramic, or cast iron would be much, much better. Avoiding makeup that has bismuth or aluminum containing products. So you want to take a look at all of your personal care products, your makeups. Sunscreen is especially important because we could be slathering aluminum right onto our skin. It gets absorbed right into our bloodstream, and then we have issues potentially detoxifying that out. For those of you who are dealing with silver fillings can contain mercury. And so if you have these silver amalgams, it might be important to find a functional dentist and have a discussion about having those taken out. Every time you chew on a mercury or silver amalgam, mercury vapors could theoretically be released into your bloodstream, again, causing seeding of that mercury in various parts of your body. So really important to talk to your dentist. And then if you're thinking about removing any silver amalgams, please find a functional dentist who really understands the importance of unbelievable careful extraction as it relates to removing these, so that the dentists themselves and the staff aren't being exposed to the mercury vapors, and especially to you, the patient, aren't being exposed to those vapors. Avoid conventional house cleaning products. Those can contain metals. What else? Costume jewelry. Again, if you're sensitive to metals, wearing costume jewelry causing rashes on your skin, then you should really be avoiding these all day long. And then the V word, vaccines, seems to be this polarizing topic. And again, not here to discuss the pros and cons of whether people should or shouldn't as it relates to vaccination. My big push is that if we are looking to reduce our exposures to any impurities that have to be detoxified out, I have continued to ask this for the last several years. Why do we have vaccines that contain mercury and aluminum in them? So the biggest head scratcher for me right now is, and I don't want to get into an argument online, but for pregnant women, if they go to their OBGYN, they're told not to eat tuna or significantly reduce their tuna exposure during pregnancy because we know that tuna fish tends to have high levels of mercury. But then I sit back and scratch my head and wonder, why do we recommend the flu vaccine that contains thimerosal to a pregnant female? because thimerosal is mercury based. So then we're basically putting it right into the body, right through the arm, into the muscle or the subcu tissue, and can get into the bloodstream and cross the placenta. I mean, so again, this to me just doesn't make sense. So again, let's try to reduce our overall exposures to impurities, especially as it relates to metals. And we all, as individuals, have to do our due diligence and make sure that we are living as cleanly as we possibly can. So, kind of moving forward, what do we do in terms of identifying if somebody is suffering from heavy metal toxicity? We like to do a provoked urine challenge test. We tend to use a test by the company Genova. And basically, the way the test works is a patient who's being screened for heavy metal toxicity would take a loading dose of a chelating agent. And a chelating agent is a medication that acts like a magnet. So it's going to pull out things in your body that have a positive charge. So metals do have positive charges to them. And so the chelating agent would act like a magnet, pull those out, and then we could test the urine for the amount of heavy metals that were excreted in the urine or eliminated in the urine for the individual doing the testing. So we do a loading dose, we collect urine for 6 hours, and then that urine sample is sent to the lab, and then any metal that has been eliminated in the urine would then be analyzed and quantified. So it's a fairly straightforward test for patients to determine if in fact they have been exposed to heavy metals. And then what do we do with that information? Well, one thing that we want to do is to make sure that we identify where metals may be coming from. So if a person has a test result that comes back as positive or containing elevated amounts of metals, let's first and foremost figure out where they may be coming from. So depending if it's aluminum, if it's arsenic, if it's cadmium, if it's mercury, we drill down further and again, try to determine where that exposure is coming from and eliminate that exposure. Then depending on the level, we may recommend doing gentle chelation, which doesn't really require anything more than some supplementation with herbs, like we might use something called HM complex, which is very gently allowing us to remove the metal from the individual's body. Or we could go all the way up to using an oral chelating agent, depending on the severity of the toxicity, to pull those metals out and restore that person's body back to balance. But again, importantly, optimal nutrition is going to be important no matter what. So we want to make sure that we're supporting the body with eating organic fruits and vegetables. We want our, if we're eating animal protein, we want that to be the highest quality animal protein, not factory farmed animals, but animals that have been fed food that is native to their diet, that is loved and treated properly throughout its life, and is euthanized in a very humane way. This bodes well for us. The healthier the animal at the time of slaughter, the better it is for our bodies, remembering that you are what you eat. Eating a diet that's high in cruciferous vegetables. Cruciferous vegetables are amazing detoxifiers. The body has multiple phases of detoxification. And as far as I'm aware, cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts impact both phase 1 and phase 2 of detoxification. So there's another great way that you can help the body daily to detoxify. And then drinking clean filtered water is another way through our intake to help eliminate toxins and keep our body functioning at a high level. If patients also are dealing with an excess amount of heavy metals, infrared sauna can be an amazing way to help detoxify out. So when we use an infrared sauna and we're using both the far and near infrared waves, that helps to push the metals out and eliminate them through the sweat while we're in the sauna. And again, really important mechanism that can help patients who are dealing with metal toxicities to detoxify. Then the other thing that I wanted to mention is that if we do have metals within our body, exposures to electromagnetic frequencies or EMFs can be exacerbated. So if there are issues with EMFs on our body, if they're causing some negative consequences, then having an elevated level of lead, mercury, arsenic, any of the metals can make the EMF exposure and the negative consequences on the body much, much worse. So we've posted on Facebook this past week about the importance of recognizing where EMFs may be coming from, electromagnetic frequencies, your cell phone, your laptops. Get those out of your bedrooms when you're sleeping at night. Move your router. This is all critical information as you're trying to live at a much higher quality of life. So all of these things begin to kind of come together and impact one another. If you do have to undergo chelation, one last thing that I would mention is that you want to make sure that you're getting adequate vitamin and mineral replacement, remembering that a chelating agent does attract things with positive charges. So that's even the good stuff. So your zinc, your calcium, your magnesium, your folate, anything with a positive charge would also be attracted to that chelating agent. So talking to your healthcare provider about how to adequately replace vitamins and minerals are absolutely important. And then supporting detoxification with the master detoxifier glutathione. So you can get that through an IV, and that's something that we do in our office is IV glutathione for patients who are deficient in glutathione. Or you can take NAC. We've talked about NAC before, N-acetylcysteine, which is the precursor step to developing glutathione. You can take that as an oral supplement. Those are really important to support the body. So anything that we can do to first and foremost identify where the heavy metals may be coming in, remove those exposures, and then assist your body in detoxification. Absolutely critical. And we want to do that day in and day out. Be mindful of how you can help your body detoxify. One last thing, if you are in Cleveland and you're interested in using the infrared sauna, remember that we are still offering first-time users a steep discount and then packages at a reduced rate as well. We want people using that sauna to detoxify out all of the stuff that is disrupting our bodies from normal body chemistry. So I know we're up against it. I went a couple minutes over. I want to thank people for watching Facebook Live. It will be loaded immediately after I conclude this so that you can watch it again and send to your friends, family, even enemies. And remember, please, please, please send us your suggestions for future topics. Next week's topic is actually going to be on thermography. So thermography is something where we can use heat to image the body and figure out where there may be problems. And I know that women have asked us specifically about alternatives to mammography or mammograms. And so thermography is one way that we can assess or screen for breast cancer. And so we wanted to have a discussion with someone who is well-versed in thermography. So we will actually have a guest. Abby Radvar will be a guest next week. So please look forward to that. And again, we want to thank you so much for participating. Remember, it's your time to thrive. Let us at Inspire Wellness inspire you. I hope you guys like the bumper. Have a great day, everybody. Thanks again.